Hello, and welcome to Diamond Care Inc.'s Medication Management and Assistance with Self-Administration of Medications. My name is Jenna Silva, and I'm your presenter for today's educational training. And I'm currently, as of February of 2026, I am the administrator. So our training objectives today is by the end of this training that the staff are going to be able to understand the Title 22 medication requirements, identify the differences between assisting versus administrating, follow proper medication storage and procedures, accurately document medication assistance, and recognize and report medication errors, changes in condition, and then above all else, remember resident safety is always a priority. Title 22 medication regulations. Medication management and RCFEs is governed by the state of California, Title 22, which is supervised by the Department of Social Services. The key sections for medication management include 87465 incidental medical and dental care, 87458 medical assessment, 87211 reporting requirements, and 87411 personnel requirements. These regulations help residents receive safe and appropriate medication assistance. What does staff do? What can they do? So, care staff may assist residents with the administration of their medication. This includes reminding residents to take their medication, reading medication labels to residents, opening medication containers, placing medications in the resident's hands, observing the resident taking the medications, and documenting the medication assistance. And all this is part of also encouraging our residents to take their medications and be compliant with said medication. What staff is not allowed to do is they may not give injections. We may assist with medication injections, but we are not the ones actually providing the straight injection. Adjusting medication dosages. So therefore, we are making a determination if we should give an extra Tylenol because they say their pain is a 10 out of 10. That also goes with doing like sliding scales on medications for blood pressure readings and glucose levels, deciding when medication should be held. The only time you should be making this determination is if you feel the resident has had a severe reaction to any medications that they are currently taking and prescribing. What you will be doing in this instance is you will automatically call 911 to get EMS to come out. You're going to notify the supervisor and administrator, and you're going to let the EMS know when they arrived that they were due for this medication, but you had concerns, whether it be a reaction, maybe they just didn't seem like they were, really all there, like they were lethargic and so forth. So that's the only time you make a determination to hold a medication. You're not going to hold a medication because you feel like it gives them too much energy or it makes them too happy or sad or depressed or whatever have you. The only time you're going to make a medication decision to hold a medication is if that medication is going to cause them harm. We're not going to interpret medical parameters. And then administration of medications that require a nursing judgment. So I know in the past we've had some residents with medication parameters. We've in the last week have gone over, prohibited conditions versus restricted conditions. And so in the instance of a person who is coming into the community and they have a sliding scale insulin, that is a restricted condition if resident is able to 100% read and understand that medication order and fully self-manage said medication. It becomes a prohibited condition when they cannot make a interpretation. And to be quite honest, when it comes to insulin parameters, unless we've got a RN or LVN on staff 24 hours a day, 7 days a week, we will probably not be allowing that, because with diabetics, they can very easily become non-responsive, not alert, where they can make that decision to interpret a medication. And the other big thing, when in doubt, contact me, contact a supervisor. And if you're really in doubt about a resident's condition and they're on home health or hospice, contact them, contact their physician, or send them out if there's a concern with the medication interaction. So assistance with self-administration. Assistance means the resident remains in control of taking their medication. This comes down to resident right. The residents do have the right to refuse medication, but however, our job as care providers is that we're going to encourage them to take the medication as prescribed. One, a lot of our residents have multiple comorbidities, heart issues, cholesterol issues, diabetes. On top of that, a lot of them have neurocognitive impairments. And so missing important medications can really affect them in more ways than one. The resident has the right to know the purpose of their medication, to be able to take the medication safely with assistance, and be able to swallow or apply medication with help. So the goal is that staff provides support and no clinical judgment. So in this training segment, you're going to see several videos that I'm incorporating to help give you guys visual ideas of how things should go and get more education than just seeing a slideshow presentation. So I really love this video and the next video that I will be showing you guys. This first one is how to administer medications.
When buying hot dogs, you want to pay right away. But buying big game tickets, that's when you probably pay.
Lindsay, I'm your carer today.
Hello, Lindsay.
Can I just check that you are Mary Fern?
Yes, I'm Mary Fern.
Good. I'm here to give you your tablets this morning.
Thank you.
Are you ready to take them?
Yes, I'm ready, thank you.
If you don't mind, I'll just go wash my hands and get a glass of water for you to take your tablets with.
That's perfect, thank you.
That's the water for your tablets. I'll just get your medication out of the MediSafe.
Thank you.
Cocodamol 8 500mg tablets, 2 to be taken in the morning. Felodipine 10mg tablets, 1 to be taken in the morning. Furosemide 40mg tablets, 1 to be taken in the morning. Ramipril 2.5mg, 1 in the morning. aspirin, one to be taken in the morning. I'll dissolve that in a little water for you, Mary. And Gaviscon liquid, 10 mils. Now, what I'll do, Mary, I'll just go and dissolve your aspirin first before I give you the rest of your medication. And I'll just check again that you are Mary Fern.
I'm Mary Fern.
Now, Mary, I'll give you your water here. Here's your tablets.
Thank you.
That's your aspirin. Lovely. And finally, your Gaviscon.
Thank you.
Well done, that's them taken. I'll just put these back in the Medisafe. I'll just go and give these a wash. Now, Mary, is there anything else I can do for you?
No, that's fine.
Someone will be in at lunchtime today to give you your next lot of medication.
Thank you. Thank you, Lindsay.
Have a nice morning, and we'll see you again.
Thank you.
Bye-bye for now.
Thank you very much. Bye.
So you notice in this video here, the care provider, went through each medication and looked at the bottle and looked at the order, said it out loud. With us, we don't always do medications in front of the resident, but the resident does have the right to know what their medications are. And so if you ever get that request, then you're going to do it just like you saw in this video. So medication orders. So all medication orders must have a physician's order. So we talked about doing what is called a triple check. And so, we are, obtaining what is called physician's orders. It's got our DCI logo on it, and we're sending it to the physician to confirm the medications that we have received from the pharmacy, from the family, or whoever is exactly what and how the physician wants us to use medication. So we're taking that medication, we're looking at the MAR, and we're looking at the order. But the things that all of that must have on it to be a complete order is it's got to have the resident's name. We put the resident's date of birth, the medication name, the strength, the dosage, the route, the frequency, and then most importantly, the provider will give the signature. Now, sometimes we might have a medication order that's from Kaiser or the VA, and it might be on their format and their setup, but regardless, it's a medication order that has all those components. Remember, DCI cannot accept orders with clinical parameters or sliding scales. If you're in doubt or somebody returns with that, or we just admitted somebody and all of a sudden that becomes part of their medication regimen, please notify administration immediately and we will make sure we remedy that situation. Medication storage requirements. Under Title 22, medications must be stored in a locked location. We have that, essentially here at DiamondCare, triple locked, the door to the office, the filing cabinet, and then the individual lock boxes, okay? Medication is kept in the original label and container. Also, remember, we do not write on the labels. We do not put our own little stickers on it because we're not pharmacy, we're not pharmacists. And so if we alter that, that can be a potential problem. The only people who are allowed to write on there is actually the pharmacy themselves. So if you ever find yourself that maybe a medication order changed, you can always ask the pharmacy for a new bottle and new label. You can always ask for the medication to be completely refilled. If you're not quite for sure what to do in that situation, please reach out. We'll be happy to assist you in that. Make sure each medication is separated by resident. If you're doing a medication pass and you see that Mrs. Jones' medication is somehow mixed in with Mr. Jones's medication, that is considered an unusual event, and so you must report that, and we must look into how that happened, and we need to monitor both residents to make sure that there are no medication interactions. We also need to notify the physicians and families as well. And then we got to make sure the medications are inaccessible to the residents, which they are. At Diamond Care, each resident has a separate labeled lockbox, and so that makes it a lot more easier, where in some bigger facilities they have what's called a medication cart, and so sometimes medication isn't necessarily stored separately. So in this video, you're going to really want to pay attention. I love this video because I feel like they gave every scenario of how not to do something. They showed it very well.
She was out last night with her new man. It sounds absolutely stunning.
What a fantastic night I had at that new Italian restaurant. Yeah, oh, it was absolutely beautiful. The meal was lovely.
Right, eh?
Tablets are over in the Medisafe.
Okay, this metal thing over here.
Hi, how are you?
I want all of them. And the liquid as well? Thanks, though.
I'll just go and get you a glass of water, Maisie.
It's Mary.
Okay. What do you do with the liquid?
Just get her to take it out of the bottle. It saves us washing a container.
Do you need to shake it?
No, it's fine.
Okay, just take a glug of that. Okay, just neck it. You'll be fine. How many of these tablets does she get? Do we have something to fill in?
There should be a form somewhere.
Oh, right, okay. Here it is. What do I do with this?
Oh, just fill it in.
I need a pen.
It's just to keep the management happy anyway.
How many does she get?
Oh, just one of everything.
I've got something to put them in.
Just use that plate.
Just put them on here for you, okay?
A nice summer outfit.
Pink's in again this year.
Gorgeous, isn't it?
Yeah, it's lovely.
Nice. Oh, and I love those shoes.
Oh, they're pretty.
Some good recipes too.
If that's the big ones, can you break them up for me?
Is that okay?
Yeah, that's fine.
Okay, I'll do that for you, pet. Last one, I think. I think that's them all. Oh, that'll be my mate. She's out with a new boyfriend tonight. Just, there you go. I'll be back in a minute. Hi, Jenny.
Can I have some water for my tablets?
Did you have a good time?
Some tea there.
Oh, but it's cold.
It'll be fine.
Right, see you later. Cheers. That was my mate on the phone. She was out last night with her new man. It sounds absolutely stunning.
Great.
Time, yeah. Get all the gossip later.
Good. We're going to go out for tea with tonight, aren't we?
Yes.
Oh,
Think so.
you should try that Italian restaurant. Yes.
Okay, is that us?
Yes, I think so. Watch your time.
Okay. Just shove all this lot back.
I'm needing my inhaler.
Oh, what's that? There's a blue box here on Ambia. All right, is this it?
That's
What do
it.
you do with this?
Oh, just a puff, I think.
Well, that's empty, I think. I don't think there's anything in it, pet.
Don't worry, leave it, and the girl tomorrow
Well,
can sort
a
it
new
out.
one.
Yeah,
Right,
yeah.
okay. You get it tomorrow, all right? Just, you'll be fine. You'll be fine. Okay. You'll be
You'll
okay.
be fine. Let's have another sweetie. Okay, nice to see you, Maisie. Right, let's
Okay,
get
see you later.
Come on.
So, this video really does a great job at demonstrating everything not to do, right? From, telling the resident to just take a swig directly from the medication bottle, to the care provider just dropping the medications on a plate, to them not paying attention to see if she really truly is taking her medication and she is swallowing her medication, to she's clearly out of her inhaler, and instead of addressing it and get it refilled right away, they tell her she'll be fine and she can wait until tomorrow. Did you see her reaction though? Right? They were calling her by the wrong name and they were doing all those things. They were using their hands. Clearly, she was not okay with it, right? So they weren't even paying attention to her body language that was cueing them in that what they were doing and how they were doing it was wrong, right? And so, a lot of times in our positions as caregivers, we develop friendships and things like that, and we can get distracted, right? And so when it comes to a medication pass, we really shouldn't be tag teaming it like that, right? And we shouldn't be chatting with each other, and we shouldn't be, just filling out the paperwork because we think that's what's going to make management happy, right? So I hope you guys saw that first video where she came in by herself, she went over the medications, she double checked them, she put them in the cup, she washed her hands. I mean, she did all the things. And then this video, it was really, really yeah. So please don't be scenario number 2. But medication documentation. So every medication assistance must be documented on the medication administration record, also known as the MAR. The document must include date and time of the medication given. You're going to initial it, right? And if any refusals happen, you'll still initial and you'll put a circle in. And then once again, on the PRN meds, right, we're going to record that PRN med with a follow-up, pain resolved, still in pain, contacted doctor, right? So documentation must be complete and accurate and must be documented immediately, because as you guys know by now, things in the facility can change very rapidly, right? And you might not get back to documenting it. So, and you should never pre-document. And what I mean by this is I've got all my meds in the cup and I've got my MAR book out and I'm initial, and then I go get the meds and they then refuse the meds, right? So you should always be coming back afterwards and doing your documentation. So PRN meds. So hopefully by now we all know that PRN means as needed. The order must have the reason, the dosage, the frequency limits, and staff must document the medication given and the effectiveness of said medication. So here's a little video on some most common abbreviations. I'm not really big on using abbreviations in our setting, but however, we do work with hospitals and physicians and pharmacies, and sometimes they do provide medications with abbreviations. And so it is really important that we understand and we know the basic abbreviations.
Hello everybody, welcome back. In this video I'm going to talk about some of the most common medical abbreviation and some of my favorite ones. If you are new to the healthcare field, this might be a helpful video to you. Let's jump on in. So some of the most common medical abbreviation are related to time when medication are given or treatment are supposed to be done. So that's what we are going to focusing on this bunch. First one is QOD. QOD means every day. Then we have BID. BID is gonna be twice a day. TID, 3 times a day. QID 4 times a day. So you sort see the pattern there, and then this one Q4H, so that's every 4 hours. And then this can continue. This could be Q6H every 6 hours, QH every hours, and it could be Q30 minutes every 30 minutes, whatever the doctor orders. The next one is AC, which would be before meal, and PC after meal. Now HS. HS mean at bedtime or night time. So until might have you be given right before the person goes bed. Then PRN, which is one of the very common one, which means given as needed. So if somebody needs a pain medication at night time, or when somebody feel pain, and then you should give as needed. The next step of medical abbreviation are routes of the administration of medication. So the first one we are going to be looking at is BO. So that means by mouth. So this is a pills which be given by mouth. They will take is orally. IM is intramuscular, like a flu shot or any type of injection that has to go into the muscle. IV is intravenous fluid or medication that has to be given through vein. It's called IV intravenous. The next one is SC or SQ, depending on where you are, would be subcutaneous. So this again is an injection, but instead of going into the muscle, it goes into the fat tissues, and that's one of the easier injection to give. And then SL, which is sublingual, and that just means under the tongue. So you put a little tablet underneath the tongue and it dissolves, and that's how a person gets the medication. Now the next set, DS, is diagnosis. So if they have a diagnosis or stroke or heart failure. Next one is HX, which means history. It's sort of the same idea. They have history of stroke or history of car accident, etc. HX means simply history. TX is treatment. And RX is one of the most common one. You might see it on a prescription pad because it means prescription. So thank you very much for watching, and we will make a second part of this video. Keep watching.
So in this video, it's just the most common diagnoses, not diagnoses, but most common abbreviations that we will see. But you'll notice they brought up IV meds. Clearly, we do not do that there. But if you ever has that abbreviation, then we clearly know there's a medication error and we need to get that clarified, right? So this next video here is how to administer medications using the MAR. And this is a nurse, and so she's doing a skills demonstration. Yes, we're not nursing, but however, the same skills apply for us here at Diamond Care.
Your perfect domain is out there. Go to Wix and make it yours.
Hi everybody, I am That Nursing Prep and welcome to my channel. In today's video, I'm going to be demonstrating how to give a PO, so by mouth, medication. So the first thing we do is look at our MAR, our medication administration record, and it could be either a paper one or one on the computer, it doesn't matter. You're going to be making sure you have the right patient, so be checking their name, their date of birth, their medical record number, any allergies that are listed, and then you're going to look for the meds. So what are we looking for when we look at the meds? We're looking for the name of the medication, the way it's going to be given, so in this case by mouth, so it'll say PO, the time it's supposed to be given, so when is it due, the amount we're supposed to give, and then when we're all done, the final right is documentation, so we'll do that. So the first check is we're checking everything out on the MAR, making sure it all looks correct. So we'll say, yes, it looks correct. Now our second check will actually go and pull the medication out. So what we're going to do is we're going to compare the medication to what it says on the MAR, making sure everything matches up. Also on the medication, you will notice an expiration date. Obviously, if it's past that expiration date, you're not going to give it. You're going to want to get a new one. So we'll say, yes, everything matches up and the expiration date is good. So that's our second check. The final thing is we're going to go into the room and actually give it to the patient. Now we've entered the room, knock, 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 hand hygiene, provide privacy, and identify the patient with 2 identifiers, name and date of birth. Now that we've done that, we're going to do our third and final check. So comparing the medication once again to our MAR, making sure everything matches up and is good. Now we're going to ask our patient, do they have any allergies? And if they say no, okay, we're good to go. If they say yes, I'm allergic to penicillin, we're going to ask them, oh, what happens if you were to get penicillin? Because you need to know the reaction. You need to know, is it like a mild reaction? Is it a life-threatening reaction? Or are they confusing an allergy with a common side effect? Because sometimes people do that. Sometimes people say, oh, if I take that and I haven't had anything to eat, I get nauseous. Well, that's not an allergy, right? That's a side effect. So you want to ask, do you have allergies? And if they say yes, what happens to you if you were to receive that? Even if that's not something you're giving, you want to know that so you can document that for the future. So we've done all of that. Everything's been checked out. Mr. Jones doesn't have any allergies. He's okay. Everything's good. Now we're actually ready to give the med. So I have yet to open it. I have my little cup here. I'm going to put it in the cup, but I haven't opened it yet because I want to let him know what I'm giving him. Because if you were to open it and then explain what it was and they go, oh yeah, I don't want that. Well, now you got to go waste it, right? So you want to explain what it is before you open it. So, Mr. Jones, this is your Colace. It's a stool softener. It's not a laxative. It's not going to make you go to the bathroom. It's just going to make it easier for when you do have to go to the bathroom. Do you want to take this medication? And it's like, yes, that's fine. Then you can actually open it and put it in the little cup. Here you go, Mr. Jones, and give him this with, a sip of water. Okay, do you have any questions for me about this medication? No? Do you need anything else from me right now? No? Okay, here's your call light. I'll be back to check on you in a couple of minutes. So that was my video on how to give PO medication.
So you notice that she checked with the resident,
not the most difficult,
if they had an allergy, what the allergy was, all the other good things, and she looked at her order. So that's just an example. This next video here, it's a little more geared towards our setting, and it is part of the Department of Disability Services video that they've put out. And so this is more applicable to us, and I hope it's helpful.
The following video includes a dramatization and demonstration of the 7 rights of assisting individuals with self-administration of medication. Any products or medications referred to in this video are for demonstration purposes only. In addition to following the procedures shown in this video, direct support professionals need to know the requirements of medication management contained in the Department of Social Services Community Care Licensing Regulations and Cal-OSHA regulations. Direct support professionals must incorporate these regulations into their daily practice of assisting individuals with self-administration of medication.
I need a cough medicine.
Okay, I can help with that. Why don't we wash our hands first?
Okay. After you.
Thank you. All right, make sure you get enough soap.
Okay.
My name is Susan. The time is now 8 a.m. and I'm going to assist you in taking your medications. Is that all right?
Yes, of course.
Great. Can I have your first and last name, please?
Jordan Bird.
Perfect. So I'm looking at your PRN authorization letter, and it looks like you can have this prescription. So we'll go ahead and have this PRN prescription with your 8 a.m. medication. Is that okay?
Okay, thank you.
Great, of course. Let's get started. Could you please tell me your first and last name?
Jordan Bird.
Thank you, Jordan. Let's start with this one here. This is a medication called Tegretol for Jordan Bird. Jordan Bird, Jordan Bird. Tegretol 400 milligrams, Tegretol 400 milligrams. Take 2 tablets, twice per day, 8 a.m. and 4 p.m. Twice per day at 8 a.m. and 4 p.m. It's 8 a.m. Orally, orally. For seizures, for seizures. Jordan, do you know why you're taking this medication?
Because I have seizures.
That is correct. This medication called Tegretol is for your seizures, and this is your 8 a.m. medication, okay?
Okay.
Great. Let's check the amoxicillin next. This medication is also for Jordan Bird. Jordan Bird, Jordan Bird. Amoxicillin, 250 milligrams. Amoxicillin, 250 milligrams. Take 1 tablet, 3 times per day for 10 days at 12 a.m., 8 a.m., and 4 p.m. 3 times per day for 10 days at 12 a.m., 8 a.m., and 4 p.m. Orally, orally. For infection, for infection. All right. I see you have another medication here. It is called Robitussin. It is your PRN medication. You mentioned earlier that you have a cough. I don't see any documentation on your chart. It looks like you have not taken it yet, so you will take it for the first time today with your other medications. Let's go ahead with the first check of this medication. This is for Jordan Bird, Jordan Bird, Jordan Bird. Robitussin, Robitussin. Take 10 milliliters, every 4 hours for 5 days, every 4 hours for 5 days, maximum dosage of 6 doses for a 24-hour period, maximum dosage of 6 doses for a 24-hour period, orally, orally, and it's for a cough, for a cough. All right, Jordan, we're going to prepare your medication now. Are you ready?
I'm ready.
Excellent. We're going to start with your 8 a.m. medication, Tegretol. This medication is for Jordan Bird, Jordan Bird. Tegretol 400 milligrams, Tegretol 400 milligrams. Take 2 tablets, twice per day at 8 a.m. and 4 p.m. Twice per day at 8 a.m. and 4 p.m. Orally, orally. For seizures, for seizures. It is 8 a.m. Let's move on to the amoxicillin. All right, this medication is for Jordan Bird, Jordan Bird, Jordan Bird. Amoxicillin, 250 milligrams. Amoxicillin, 250 milligrams. Take 1 tablet, 3 times per day for 10 days at 12 a.m., 8 a.m., and 4 p.m. 3 times per day for 10 days at 12 a.m., 8 a.m., and 4 p.m. orally, orally, for infection, for infection. All right, and the Robitussin for your cough. This medication is for Jordan Bird, Robitussin, Robitussin. Take 10 milliliters, take 10 milliliters, every 4 hours for 5 days, every 4 hours for 5 days, maximum dosage of 6 doses for a 24-hour period, maximum dosage of 6 doses for a 24-hour period, orally, orally, for a cough, for a cough. All right, Jordan, are you ready to take your medication?
I'm ready.
Great, and I have some water for you. All right, let's go ahead with our last check. All right, the medication Tegretol is for Jordan Bird, Tegretol, 400 milligrams, Tegretol, 400 milligrams. Take 2 tablets, twice per day at 8 a.m. and 4 p.m. Twice per day at 8 a.m. and 4 p.m. It is 8 a.m. Orally, orally, for seizures, Go ahead and have some water before we get started. And we're going to start with Tegretol. Did that go down okay?
Yes, it did.
Great. And let's go to amoxicillin. This medication is for Jordan Bird, Amoxicillin, 250 milligrams, amoxicillin, 250 milligrams. Take 1 tablet, 3 times per day for 10 days at 12 a.m., 8 a.m., and 4 p.m. 3 times per day for 10 days at 12 a.m., 8 a.m., and 4 p.m. Orally, for infection, Here's your amoxicillin. Did that go down okay?
Yes, it did.
Great. Let's move on to Robitussin. This is for Jordan Bird, Robitussin, Take 10 milliliters, every 4 hours for 5 days, maximum dose of 6 doses for a 24-hour period, orally, for a cough, And here's your Robitussin. How was that?
It went down okay.
Great. I'm going to check on you in about an hour to see how you're doing, and we'll see how your cough is as well. Jordan, I said I would check on you in an hour. So how are you doing? How's your cough?
My cough is better. I'm doing okay. And thank you for asking.
Of course. I'm so happy to hear that. Well, you have an excellent rest of your day, okay?
Okay, I will.
Okay, great. Bye.
Bye.
The direct support professional should always monitor the individual and document and report to the doctor any changes in the individual's circumstances surrounding the specific prescription. The right individual, the right medication, the right dose, the right time, the right route, the right reason, and the right documentation. Always taking care to follow these crucial steps of the 7 rights and keeping careful medication administration records will help to ensure the safety and comfort of the individual being assisted in the self-administration of medication. Remember, prevention is the #1 priority. The following are some reminders that the direct support professional should follow when assisting with the self-administration of medication. Always begin and end with proper hand washing. Always store medication and the medication administration record in a securely locked cabinet. Always compare the medication label to the medication administration record. Always remind the individual why they are taking the medication. Always place blister packs over a cup when punching out pills. Always place medication in the cap of the pill bottle first and then place the pills in a cup. Always prepare liquid medication by pouring it and measuring it at eye level. Always watch that medications are fully consumed by the individual. Always enter the direct support professional's initials on the medication administration record in the box that corresponds to the date and time right after each medication has been taken. Always return medication and the medication administration record to a securely locked cabinet. Never leave medication unattended. Never crush medication without first checking with the doctor or pharmacist. Never hand medication to one individual to give to another individual. Only one direct support professional should assist the individual with the self-administration of medication from the beginning to the end. Never give injections, enemas, or suppositories. These can only be given by a licensed healthcare professional.
So I really love that the Department of Social Services places a video out like this because it really does help us see all the right things in our type of setting. So the next several videos that I will be showing you guys is different ways of administrating other medications. And so this one right here is on ointments and creams.
Okay, it's now been 15 minutes since we applied your moisturising cream, so we can now apply the cream that your doctor's prescribed for you. You've got to apply it to the inside of your elbow. That's it, so if you can just put your hand out for me. I'm just going to put a tiny little bit in my fingertip. I'll just rub that in. Lovely. And that's you done.
Fine, thank you.
These are some points to consider when you're administering medicated creams, ointments or gels. First of all, you must always wear gloves. This is to prevent the drug being absorbed through your own skin. If you're applying moisturising cream, do this at least 15 minutes before you apply the medicated cream. The amount that you require will depend on the area that you're treating. As a rough guide, if you squeeze a ribbon of cream from your fingertip to the first crease of your finger, this is enough to cover an area twice the size of the flat of your hand. Gels and creams will rub completely into the skin, but ointments will leave a fine, greasy protective layer on the top of the skin. If you have any queries about where you need to apply the cream, how long you need to apply it for, or if the person is non-compliant, contact your GP.
So this video is going to be on how to administer an inhaler. I have noticed that we don't always have what is called an aero chamber, and so that is something that I will be working on. But all inhaled medications really should be administered with an inhaler. The number one reason is it helps with breath coordination. It also allows the medication to get into the smaller particle sizes that is actually intended to be, which will allow the medication to be inhaled in much deeper to the lower parts of the lungs. If you have a client who has a inhaler like Spiriva or a disc inhaler, those don't have what is called an aero chamber. Those are dried inhaled medications. They're not aerosoled. So they're different mechanisms. And so the client really needs to be able to breath coordinate, but it's not as difficult as when we're doing the aerosol medications, because that is, you got to take that breath right then and there. Where with like Spiriva and the other disc medications, it is a dried inhaled medication. So once you actuate the inhaler, that medication actually sits in there until they inhale it out of the chamber. But this video right here is going to go over some details for you guys.
Choose debit or pay later. One card, 2 ways to pay. Sign up with Klarna. No credit impact to apply.
Now we're ready to give you your inhaler. So I'm just going to give it a shake, put it in the spacer. Now what I want you to do is to breathe out, put the spacer into your mouth and start to breathe in through the spacer. And as you're starting to breathe in, I'll press down on the inhaler and you just keep taking the whole of your in-breath through that spacer. Then I want you to hold your breath for as long as you can and then breathe out. So if I give that to you, So I want you to breathe out first. Put the spacer into your mouth. Start to take a deep breath in. I'll press down on this. Take a nice deep breath in for me. And then hold your breath for as long as you can, and then just breathe out. We'll just let you rest for 30 seconds, and then we'll do the second one. So we'll do the same again. So breathe out. Put the spacer into your mouth. Start to take the in breath. Nice deep breath in. Hold your breath for as long as you can, and then just breathe out. That's you done. Thank you. Now we're ready to give you your inhaler, so I'll just give it a shake and put it in. Now all I'm going to do is put the mask over your face, and I just want you to keep breathing normally through it. I'll put a puff of the inhaler into the spacer, and I'll count 5 breaths, and then I'll take it away. Okay? So if you put the mask over your nose and your mouth, breathe in and out normally. 1, 2, 3, 4, 5. I'll take that. Now we'll just leave you 30 seconds and then give you a second puff. So nice deep breath in. 1, 2, 3, 4, 5. That's you done. Thank you. Here are a few things to remember if you are administering inhaled medication through a spacer. Only administer 1 puff at a time and leave 30 seconds in between puffs. Once you have administered the inhaler, ask the person to rinse their mouth out with water or to take a drink. This is to reduce the risk of side effects in the mouth. If you need to clean a spacer, use warm water and leave it to dry on the draining board. Do not use a tea towel. If the person is unable to comply with the inhaler and spacer, do let the GP know.
So this next video is going to demonstrate how to properly help somebody with a nasal spray.
1 card, 2 ways to pay. Get a debit card that lets you pay later. Sign up with Klarna now. No credit impact to apply.
Now we're ready to give you your nasal spray. First thing I'm going to ask you to do is if you can just blow your nose into the hanky. That's lovely, and if you can keep a hold of that. Now we're ready to give the nasal spray. Just put the top down there. Now we have to do a spray in both nostrils. So first of all, can I ask you to take your left hand and block off your left nostril. I'm going to get you actually just to take your head forward and even tip it just slightly forward. Lovely. And then on the count of 3, I'm going to ask you to take a deep sniff in. So ready? 1, 2, 3. Lovely, and you can dab there. Now I've got to put a spray in each nostril, so I'm going to come round and do the other one. You can just pop your right finger there. Perfect. And we'll tilt your head a little bit further forward. Lovely. Put this in. And the same on the count of 3, I'll get you to take a sniff in. Ready? 1, 2, 3. Lovely, and you can dab your nose now. And that's you done. Thank you.
Okay. So this next one covers patches. Something to remember when administrating patches. what are we putting the patches on for? So for example, if somebody is doing smoking cessation, they really shouldn't be smoking with a patch. If it's a pain patch, we really ought to make sure that the doctor or the home health or the hospice is aware of other pain medications the individual is taking, just because we don't want to have an overdose of situation. And it's always ideal to rotate patch sites. But here's our video.
When buying a coffee, you want to pay right away. But buying tickets to Paris, that's when you probably...
Okay, we'll get your patch changed for you now. Just have to roll your sleeve up. There's your old one, so I'll just peel that one off. Okay, and now we'll get the new one out of its packet. Right, I'll put it in a different area, so I'll just put it down here for you. Just going to hold that for 30 seconds to make sure it sticks. There we go, and that's you done. Take your sleeve down. Thank you. There you go. Here are a few other points to consider when administering patches. To ensure a consistent supply of the drug, agree a time of day that the patch changeover will occur and be consistent with this. However, do remember that not all patches require to be changed daily. Always remember to remove the old patch before applying the new patch. To reduce the risk of skin irritation, you must rotate the site of the patch. For this reason, keep a written record of where you have applied each patch. The most common sites to apply patches are the upper arms, the back, the side of the torso above the waist, and the chest. To further reduce the risk of skin irritation, avoid applying the patch to areas of skin that are broken, inflamed, or have obvious blemishes. To ensure that the patch will stick, ensure that the skin is clean, dry, and not excessively hot. To minimise discomfort when the patch is removed, avoid applying the patch to an area of skin that is particularly hairy. If you need to, you can use scissors to trim the hair. However, do not use a razor, as this will cause further skin irritation. If skin irritation does occur, or if the patient is unable to comply with having a patch, contact the GP.
So the next one here is going to how to administer a nebulized treatment. So a nebulized treatment is typically done for like your severe COPD patients, your asthmatics, and it's usually done when the handheld inhaler is not effective, or in times of acute crises such as a respiratory infection.
When buying a soda, you want to pay right away. But booking your next trip?
Now, Catherine, it's time for your medicine. We've got the nebulizer and it's plugged in. Now, you've had this before, haven't you?
Yes.
And you don't mind the nebulizer mask on your face?
No.
That's good. Are you sitting comfortably?
Yes, fine.
That's fine. Well, we'll just connect the tubing to the nebulizer. We'll check the tubing to the reservoir, and then we'll just pop the
Please do not pop the lid off like this. You never want to do that. You actually want to administer it through the opening to that top part. If you've got questions, please come see me. As a respiratory therapist, that makes me cringe.
Now, do you fit the face mask yourself, or would you like some help?
I'd like some help, please.
I'll just come round and help you here. Now, Catherine, it just goes over your nose and mouth, and then the elastic goes round your head. There we go. Just sit it there. Put the elastic around your head, and just make sure it's not out on your ears. Is that comfortable? That's fine. So I'm just going to switch on the nebulizer now. It's going to take about 6 to 10 minutes. So if you want to stop, if you need to cough, or if you're uncomfortable, give me a sign. Okay? Now, Catherine, that's it finished. I'm just going to switch it off. Is that okay? Now, I'll just come round and help you with taking the mask off. There we go. Is that okay?
That's perfect.
Are you feeling better?
A lot better, thank you.
That's good. That's fine. Now, we'll just disconnect the tubing in the face mask and pop it in the waste. That's it, and I'll see you later.
Thank you.
Bye.
Bye.
Something I want to point out when we are given nebulized medications, some nebulized medications such as albuterol can make someone feel very jittery, uneasy. It can have their heart rate increase afterwards. This is a very common side effect when administering a nebulized treatment. If the resident has a history of cardiac issues or cardiac problems, you might want to just monitor them. And if they complain of chest pain after receiving a nebulized treatment, make sure you contact one of the supervisors, and they may need to go out for an evaluation. The other thing with nebulized medications is the reason why we don't take that top off when we stick that nebulized medication in that bowl is anything that touches that bowl is now being nebulized up into the lungs. And the little vials that the medications come in are not sterile. And so the gloves you're using are not sterile. And so you can have some kind of germs or lint or something, and it's going to be put into their lungs. So when we have somebody with nebulized treatments, I will make sure I show that with you guys. Some nebulized treatments can be done every 2 to 4 hours. If they're receiving like an albuterol with a secondary medication, then it might be at various different times. But just note that it's not uncommon for people to feel a little shaky and jittery after receiving a nebulized medication treatment. So we are going to take a pause here. This video segment on your guys' medication administration is going to be in a 2-part series. And so we're going to end this recording here. Please make sure you look for the link for the second half.